My name is Shanna Boyer, and this is my respiratory physical assessment for the Nursing 305 class. It is December 2015. Our patient today is Jake. Jake is a healthy 29-year-old male. Good evening, Jake. How are you today?
Good, how are you?
My name is Shanna. I'm going to be the nurse that's doing your respiratory assessment today. What's the reason that you're here for this checkup today?
Routine checkup.
Just a routine physical, nothing new there, anything that you've noted?
No.
Okay, good. How would you describe your breathing today?
Normal.
It's normal? Okay. Are you usually a mouth breather or a nose breather?
Nose.
Nose? Occasionally mouth breathing or no?
Not usually.
Okay. Have you noticed any changes in your breathing over the past, say, 2 days?
No.
Anything in the past 2 weeks? 2 months?
No.
2 years?
No.
So everything's been pretty good? Okay, good. Do you have any allergies that I need to be aware of?
No.
No allergies? Okay. Do you have any current respiratory symptoms that that you've noticed? Any coughing, shortness of breath, wheezing?
No.
Nothing like that? Okay, good. Have you had any recent illness?
No.
Good, healthy? Good. Any medical conditions that I need to be aware of? Anything in your medical history?
Acid reflux.
That's it? Okay. Do you take any medications?
Nexium.
Any over-the-counter stuff like vitamins, supplements?
Daily vitamin.
Okay. Anything else?
No.
Okay. Do you currently use any type of tobacco, and that's cigarettes or smokeless tobacco?
I use snuff.
About how much per week would you say?
Probably 5 cans.
Okay. Have you ever gotten the flu vaccine?
No.
Ever?
No.
Okay, and you didn't get it this season. Any reason to have the pneumonia vaccine?
No.
Okay. Do you have any, disorders that you're aware of that were related to your lung function, like any asthma, anything like that?
No.
Anything in your family's history
Nope.
that you're aware of? Nothing? Okay, good. Do you currently have any type of cough? Any trouble sleeping at night that's related to your breathing? Any increased mucus production, coughing up any bloody secretions, anything of that sort? No? Okay, good. I'm going to take your vital signs now. Just going to put my gloves on here. After I take your vital signs, we're going to continue our assessment. And that'll be the portion where I need you to remove your shirt. I need to kind of look at things, feel things, listen to things. So if you're comfortable with that, is that okay?
Yes.
Okay. So let me take your blood pressure. If you could just extend your arm for me, please. Alright, sir. Thank you. Okay, Jake, for the next portion of the exam, I'm going to have to ask you to remove your shirt. I need to take a look at your chest and listen to everything.
Okay.
Is that okay?
Yes.
Okay. Go ahead. And you can stand if you prefer to stand. If you would like to be seated, you could be seated as well.
This is fine.
Okay. I'm first going to inspect his chest. I'm looking at his skin color. His skin is pink, both on the front and the back of his chest. As he's breathing, I notice that he's not using any accessory muscles. His rate is regular and unlabored. He doesn't appear to be having any shortness of breath. When I look at his fingernails, I notice that they're pink in color and he does have good capillary refill. He doesn't have any clubbing noted of his fingertips or his fingernails. The next thing I'm going to do is I'm going to palpate both the front portion of the chest and the back portion of the chest. Let me know if you have any tenderness or pain whenever I feel your chest, okay? So I'm first feeling up here. I'm noting any masses, any areas of tenderness. Do the same on your back. Again, noting for the same thing, any tenderness, any masses, nodules, anything of that sort. Any pain or tenderness while I was touching?
No.
No? Okay. The next thing I'm going to do is I'm going to feel as you're breathing, just to make sure that you're breathing symmetrically, that I can feel. So I'm going to put my hands on the back portion of your chest. Turn this way for me. I'm going to ask you to take a couple nice deep breaths for me. As he's breathing, you note that he has symmetrical chest expansion. One side is not expanding more than the other. And as he's breathing, my fingertips are expanding equally with his respirations. Okay, thank you. The next thing, go ahead and turn. The next thing I'm going to do is I'm going to percuss the chest. You do this just in a light tapping motion. I'm feeling for any dullness over the lung fields. I'm going to do the same thing on your back, if you could turn, please. Thank you. Okay, thank you. The last thing I'm going to do is I'm going to auscultate over all of the lung fields. We're going to start again first on the front portion of the chest, and then I'll ask you to turn around in the back portion. You can breathe normally for this. I don't need you to take repeated deep breaths. Okay? As I'm listening, I'm noting for any wheezes, any crackles, any adventitious sounds over all of the lung fields. Okay, Jake, if you could turn around for me, please. Okay, thank you. The last portion of the exam, I'm going to assess the patient's voice. So what I'm going to do, Jake, is I'm going to listen to your back again. The first part that I'm going to be testing is bronchophony. So I need you to say 99 each time you feel me move the stethoscope on your chest or on your back.
Okay.
Okay?
99. 99. 99. 99. 99. 99.
The next part that I'm going to assess is egophony. This is a similar assessment, Jake. What I need you to do is each time you feel me move the stethoscope, I need you to say E. Okay? Pretty simple?
Yeah. E. 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 E.
Okay. The last portion of the voice assessment is called whispered pectriloquy. What I need you to do again is whisper 1, 2, 3 as I move the stethoscope across your back. Okay? But make sure you do it in a whisper. Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Thank you. As I inspected the thorax, I noted again that the skin was pink and even in color. The nail beds were pink and there was brisk capillary refill. The shape of the thorax was also normal. There was no barrel chest noted, as well as symmetrical movement of the chest and the overall shape of the chest. Again, there was no accessory muscle use noted, no nasal flaring. The breathing pattern was regular, even, unlabored, and the patient had a normal posture. With palpation of the thorax, again, both on the anterior and posterior thorax, there was no dullness noted. There was normal muscle mass. There was no lumps or nodules. The patient reported no tenderness or pain upon palpation. And as the assessment was going, there was no tactile fremitus noted. With percussion, both the anterior and posterior thorax, there was no dullness or flatness that was present on percussion. And during the diaphragmatic excursion, there was also no dullness or flatness percussed. Over both the anterior and posterior thorax, as the lung sounds were auscultated, the breath sounds were regular and even. Over the vesicular areas, the breath sounds were soft and low-pitched, and that was even bilaterally. The bronchovesicular areas had a medium pitch, and they were even. The bronchial sites that were assessed had normal sounds. There were no wheezes or any adventitious sounds noted, and the tracheal sounds were rather harsh and high-pitched. When the patient was assessed for bronchophony, the sounds were muffled in all of the lung fields. The E was auscultated throughout all of the lung fields whenever the egophony was assessed. And when the whispered pectriloquy was assessed, the sounds were faint in all of the lung fields.